Good evening and welcome to Kini News. Malaysia has hit an all-time high yet again for the second consecutive day. The Health Ministry has announced 2,188 new Covid-19 cases today.
Malaysia recorded 2,188 new Covid-19 cases today, marking a new record in the number of daily cases for the second consecutive day. The previous record was yesterday's 1,884 cases. The spike in cases was once again caused by the Teratai cluster, which is linked to top glass factories in Klang, Selangor. Selangor reported the highest number of new cases with 1,623 cases. Out of these, 1,511 came from the Teratai cluster. Sabah reported the second highest number of cases with 232. This was followed by Perak with 112, and Kuala Lumpur with 90 new cases. 4 deaths were also reported today, bringing the total number of deaths in the country to 341. 3 of the deaths were in Sabah, and 1 was reported in Penang. Meanwhile, the Health Ministry also announced that the mandatory quarantine order on Sabah arrivals will be lifted. Health Minister Dr Adam Baba said that from tomorrow, COVID-19 negative travellers arriving from Sabah will no longer need to undergo a 14-day home quarantine. In a statement earlier today, he said the National Security Council decided that the mandatory quarantine order will be lifted following a drop in COVID-19 cases in the East Malaysian state. He said that those flying out of Sabah to other parts of the country will need to take a swab test 3 days before departure. Travellers leaving Sabah will be subject to a screening for fever and other symptoms, as well as a COVID-19 swab test. And if they are confirmed to be COVID-19 negative, the travellers will not need to undergo the 14 days of mandatory quarantine. Those who test positive for the virus will not be allowed to fly and will instead be sent to the hospital for observation and treatment. The mandatory home quarantine order was previously imposed on October 11th on all travellers arriving from Sabah. Sabah was previously the epicenter of the country's COVID-19 epidemic.
There was an uproar this morning in the Dewan Rakyat when several MPs questioned whether the Keningau MP Jeffrey Kittingan had breached the 14-day COVID-19 quarantine order for Sabahans arriving in Kuala Lumpur.
Opposition lawmakers questioned why Keningau MP Jeffrey Kittingan was allowed to be in the Dewan Rakyat today, less than 14 days after he returned from Sabah. Warisan Sempangah MP Muhammad Aziz Jaman questioned Kittingan's presence when he had last been seen in Sabah on November 12.
Kami daripada Sabah ni, Tuan Yang di-Pertua, sentiasa akur kepada setiap perintah yang diarahkan oleh Yang di-Pertua berkenaan dengan peraturan-peraturan mesyuarat. Apabila datang ke Semenanjung ini, kita kuarantin 14 hari. Saya duduk di Kuala Lumpur ni, Datuk Yang di-Pertua sudah hampir 2 bulan tak jumpa anak dan bini. Sebab kita tak balik ke Sabah kerana kita tidak mahu nanti bila balik ke Sabah kita akan dikuarantin lagi 14 hari. Jadi Yang di-Pertua apa yang saya tahu, Yang Berhormat Keningau ada di dalam Dewan ini, dia menghadiri Dewan Undangan Negeri Sabah pada hari Khamis 12 November. Jadi bermakna kalau dikira mengikut hari, dia tidak sepatutnya berada di dalam Dewan ini. Kerana asas kita dikuarantin kerana ingin mengelakkan agar ahli-ahli parlimen ini jangan sampai terjangkit.
Other opposition MPs had also rose up to question his attendance. Deputy Speaker Azalina Osman Said then read out a response from the Dewan Rakyat Secretary on the matter. She said Kittingan was allowed to attend the sitting by the Parliament Clinic doctor because he received a release order from the Health Ministry after completing his quarantine. Azalina then urged all dissatisfied MPs to seek an explanation with Speaker Azhar Azizan Harun. When quizzed on this later, Azhar said that Parliament was informed that the Keningau MP was released from home quarantine yesterday after testing negative for COVID-19. His home quarantine order identification wristband was also cut. He added that he would contact the authorities for clarification.
Izinkan saya sedikit masa untuk menghubungi pejabat kesihatan daerah Lemah Pantai ni yang release ban tu untuk mendapatkan maklumat lebih lanjut lah. Saya cuma ikut apa yang diberikan kepada saya.
Sementara itu kita nak satu ruling Keningau tak boleh masuk dewan langsung.
Ya, saya telah minta yang berhormat keluar daripada tidak menghadiri dari tadi.
Okey.
Ya.
Risk assessment by the Health Ministry and the National Security Council will determine if there is a need to declare an emergency in Gerik and Bugaya to postpone the by-elections that are scheduled to take place there.
The government may consider recommending emergency declarations in the constituencies of Gerik in Perak and Bugaya in Sabah in order to put the by-elections there on hold and help prevent the further spread of COVID-19. This is according to de facto Law Minister Taqiyuddin Hassan.
Sesungguhnya kerajaan pada hari ini telah berusaha sedaya upaya untuk membendung penularan COVID-19 di negara kita ini. Atas sebab itulah, berpandukan kepada perkara 150, Jemaah Menteri memutuskan untuk mengarahkan Perdana Menteri menasihatkan Yang di-Pertuan Agong untuk mengisytiharkan sebahagian daripada persekutuan iaitu Parlimen Batu Sapi supaya diisytiharkan darurat. Tindakan yang sama juga akan dipertimbangkan dan dilaksanakan untuk bagi Dun Bugaya dan Gerik sekiranya berdasarkan penilaian risiko oleh Kementerian Kesihatan dan Majlis Keselamatan Negara MKN, ianya berlandaskan sebagaimana di Batu Sapi.
Taqiyuddin was responding to a question by Pontian MP Ahmad Mazlan, who asked whether the government was intending to advise the Agong to declare an emergency in Bugaya and Gerik. Last week, the Yang di-Pertuan Agong, Sultan Abdullah Sultan Ahmad Shah, assented to a proclamation of emergency in Batu Sapi, Sabah, as a proactive measure to curb the COVID-19 outbreak, which allowed for a postponement on the by-election for the parliamentary seat, initially set for December 5th. The by-election was called following the death of its incumbent, Liu Viu Kiong, last month. Since then, both Gerik MP, Hasbullah Osman, and Bugaya Assembly Person, Manis Muka Muhammad Dara, have also passed away.
Bukit Gasing Assemblyperson Rajiv Rishyakaran launched an initiative today offering cheaper private COVID-19 testing.
Bukit Gasing Assemblyperson Rajiv Rishyakaran has launched an initiative today to subsidize the cost of COVID-19 testing. Rajiv said the initiative, which began exclusively for Bukit Gasing residents earlier this month, has been expanded to everyone in an effort to bring down the cost of COVID-19 testing and make the test accessible to the public at large.
Today, starting today, we are opening up what used to be restricted to Bukit Gasing residents under the subsidy scheme previously to an open one where anyone can get tested at only 70 ringgit. And so this would be the cheapest testing on the market right now.
Rajiv added that anyone who was interested would need to register for the COVID-19 test with their name, address, IC number and contact number via WhatsApp to the designated hotline. He said his office had procured the exact same RTK-AG kits from the same vendor as the Health Ministry and is providing these kits to participating clinics. He also highlighted that based on the negotiations he had with the supplier of the test kit, he believes that it is possible to do the RTK-AG testing nationwide at 70 ringgit for everyone without subsidy if the government chooses to embark on it. He added that making tests available at a more reasonable price could be the key to containing the spread of the disease.
And still to come, the transition process for the United States President-elect Joe Biden has formally begun. What does that mean? Find out after this. Welcome back. After weeks of waiting, President Donald Trump's administration on Monday finally cleared the way for President-elect Joe Biden's transition to the White House.
The General Services Administration, the U.S. federal agency that must sign off on the presidential transition, told President-elect Joe Biden on Monday that he can formally begin the handover process. GSA Administrator Emily Murphy said in a letter that Biden would get access to resources that had been denied to him because of the legal challenges seeking to overturn his win. U.S. President Donald Trump wrote on Twitter that he was recommending that Murphy and her team, quote, do what needs to be done with regard to initial protocols and have told my team to do the same. The GSA announcement came shortly after Michigan officials certified Biden as the victor in their state, making Trump's legal efforts to change the election outcome even more unlikely to succeed. Trump and his advisors said he would continue to pursue legal avenues, but his decision to give Murphy the go-ahead to proceed with a transition for Biden's administration indicated that even the White House understood it was getting close to time to move on. Lawmakers and business executives have put pressure on the little-known federal agency to recognize the November 3rd election results and free up millions of dollars in federal funds, office space, and briefings for Biden's team. The GSA had said Murphy, who was appointed to her job by Trump in 2017, would ascertain or formally approve the transition when the winner was clear. Trump has repeatedly falsely claimed that he won the race and has spent weeks offering baseless claims of widespread voter fraud that have repeatedly failed to gain traction in the courts. Biden is due to take office on January 20th after having won the election, with enough state-by-state electoral votes to secure the Electoral College win. The Democrat leads in the national popular vote by more than 6 million. Trump's fellow Republicans have slowly broken from the president in recent days to urge the transition process to start.
Indonesia has now recorded over 500,000 coronavirus cases and more than 16,000 deaths from the same virus.
Hospitals across Indonesia are close to breaking point with COVID-19 patients as the country reached a grim milestone on Monday in surpassing more than 500,000 coronavirus cases. Deaths also hit a grim milestone on the same day, surpassing 16,000. Indonesia has the highest number of cases in Southeast Asia, having struggled to contain the spread since its first case in March. Patient occupancy at 27 referral hospitals in the capital of West Java province, home to almost 50 million people, was at 88.8%. More than 502,000 infections have been recorded in Indonesia, and public health experts say the shortfalls in testing and contact tracing suggest the real numbers are likely to be significantly higher. In Jakarta, where relatively loose social restrictions will remain in place until the end of the next week, locals met the milestone with glum resignation.
Our economy is crumbling and there's a decrease in people's purchasing power. We lost 90% of our sales. Also, there's an air of fear among the people. If we want to start a business, it will meet a dead end. I would say Indonesia's economy is falling at 100%.
Epidemiologists warn Indonesia's struggle with the virus is far from over. One was quoted as saying, infection rates are still increasing in all provinces. Nowhere has reached its peak. The head of the COVID-19 task force has called for more action to ensure hospital occupancy does not rise further.
A potential COVID-19 vaccine in the United Kingdom has shown positive results in yet another breakthrough in the race to finally end this health crisis.
AstraZeneca is now the latest drug maker to reveal a vaccine that could potentially help end the global health crisis. It announced that the vaccine, which was developed by Britain's the University of Oxford, could be 90% effective and works in different age groups. AstraZeneca and Oxford also confirmed no one who took part in the experiment showed any serious side effects. The vaccine was 90% effective in preventing COVID-19 when it was administered as a half dose, followed by a full dose at least a month later, according to data from late-stage trials in Britain and Brazil. The effectiveness of AstraZeneca's vaccine depended on the dosing and fell to just 62% when given as 2 full doses rather than a half dose first. But scientists caution against seeing this as evidence that it could be less useful than rivals. The British drug maker said it will have as many as 200 million doses by the end of 2020, around 4 times as many as US competitor Pfizer. Several hundred million doses could be ready globally as soon as the end of the first quarter of 2021.
That's all the time we have for this evening. For more stories, go on over to KiniTV.com. Don't forget that we also post up the latest news on Instagram, Twitter, YouTube and Facebook, so follow us to get the latest news updates. And don't forget when you go out to wear your mask and observe social distancing. I'm Daniel Anthony. Thank you for watching. And as always, stay safe, Malaysia.